Okay. Hi, Byron. What are we about to do today?
Hi, Gina. In our latest installment video series for our YouTube channel, I'm going to demonstrate briefly traditional fire cupping, but then we're going to transition into a more modern plastic home use set that is safe and easy to learn for everyone at home. But we'll talk a little bit about traditional cupping, the benefits, and the application. But this is not something you'll want to do at home because of the fire and the alcohol that's used.
And you're referring to the glass cupping that you're about to show,
The
right?
glass cupping.
Perfect.
So
Okay.
in either style of cupping, you do put oil, and I recommend a massage oil instead of a lotion. Lotion absorbs into the skin too quickly, and the cups will not slide as well, and you have to reapply the lotion a lot. The oil creates a better seal. It
Okay.
actually makes it feel better. Sometimes patients will, after they felt cupping done in my office, they'll say, "Well, I never had it with oil, or only one or two cups were used," and they were not as impressed with the kind of the dry feeling, and it can hurt without using oil.
Right.
So the back here is oiled up very well. I've pre-soaked cotton ball in alcohol, holding it with a hemostat, and a candle is burning. These are the traditional glass cups. So I just light the cotton ball. The idea is to put the cotton ball into the cup quickly and then onto the skin, and that creates the vacuum. They do come in different sizes, as you can see. Cupping can be applied in most areas of the body, but I'd say 95% of the time it's done on the back.
On the back.
It's excellent for back pain, tight muscles, super effective for people who have cough, asthma, phlegm,
Right.
residual phlegm, or the symptoms of a cold.
Right. And Byron, I'm noticing here in the cups, which you and I have done this before and also had this before. What's happening inside the cups with his skin?
Well, the
Perfect.
premise of the cupping is to actually suck the skin and the muscle and the blood up into the cup. And that creates a vacuum and then allows for circulation. See here, we can actually move the cups as well.
Which is another important benefit of the oil, correct?
Right, the oil allows the cups to slide. I'm moving these a little quicker. Um, Sometimes I will move them quickly during a full session, which usually the whole back will be covered
Right.
by around at least a dozen, maybe 14, 16 cups.
Right. And then I remember talking with you. Sometimes the circles are they're darker in color or lighter in color. Can you explain again what that difference is?
Right, you can see that there was a cup here for a little bit, and there's very little redness, or what we call shaw.
Right.
Shaw actually means sand, or the discoloration that gets pulled up. Here, where it's darker, that's what we call the shaw that's come to the surface. So there's a direct correlation between the darker the circle
Okay.
versus the lighter the circle. The darker the circle indicates more tension, more blockage, more muscle tightness,
Oh,
even blood stagnation, where
okay.
the muscle is so tight, creating chronic pain, that the circle becomes sometimes dark red or even purple.
Okay. Well, that might explain why a cupping session can feel very much like you've had a massage afterwards because of the reduction in the tension in the muscles underneath, right?
Oh yes, in fact, usually a cupping session in most cases can give someone relief for a week, even longer, and often sometimes a massage may only feel really good while it's happening and maybe give some temporary relief for a few
Right.
days afterwards. while the cupping tends to hold very well.
Right. Fantastic.
So what we also want to demonstrate then today, and this is really the main reason why for the video we're just showing the one side, is because we don't want to completely discolor the back, because we really want to show the plastic or the home use set, which really can be bought usually on Amazon or other massage type wholesalers for somewhere around $30 to $40 for a set of maybe 20 to 25 cups, which is what I recommend.
Right. And very much like the glass cups that you have, the home use cups, and let me just show a moment here, they also come in different sizes as well, and Byron will demonstrate those in a moment. This allows people at home to do this without having to know the traditional fire technique. Now, before we start using the plastic cups, for home users that may ask this question, what is the contraindications? What is the safety? Is there, because I remember I've used it with I've let my nephews actually do cupping on me. Can you talk about where people should have caution, or is there really any caution other than using, playing around and getting too much suction out of the home cups, right?
Yeah, well, typically with a fire, there are some cautions that I would just recommend to go see a professional to use the fire version, because sometimes the alcohol can get on fire, and if the cotton ball drops or alcohol gets in the cup, then that can actually burn the skin.
Right. Or if you're clumsy like me, the glass is going to end up all over the floor. So that's why the home people like the plastic cups.
As far as the home use set, you wouldn't want to do it on any broken skin. Any areas where there might be a rash or eczema that might cause some bleeding. Cupping's typically avoided for pregnancy.
Oh, good. Okay.
Other than that, it's really based on, and we'll show this in a minute when we demonstrate the plastic cups, how many pumps dictates how much suction, and if it's painful, you wouldn't want to pump it so much.
Perfect.
Okay.
Perfect. Okay. Okay, all right, so we traded places, obviously, and I am about to show the home use of, or how to use these home use cups. They're very simple. They have a little valve on the top, and it comes with this little gun that just fits very nicely onto the valve, secure like that. And you place it onto the skin, and I find that I start with 2 full pulls of the pump. It seems like 3 is too much and uncomfortable for the person receiving the cupping. On younger people, I've even gone as little as 1 pull or 1.5. So again, we just place the cup. You just kind of place it on the skin. 1, 2. And then you just hold the cup and pull it off. And Byron, while we're doing this and while I'm moving these around, can you explain how people would know where to place the cups? Did you do that already? I don't think so.
Usually my preferences is to treat the whole back. Okay. At some point in time, I like to get full coverage in every area of the back, and then kind of like the Olympic rings, I like to fill in the space between the rings so that we get really full coverage. And once you're into the routine for about 5 minutes usually, you kind of get a pretty good idea of where the deeper circles indicating the true tension, where those areas are, and then you may focus a little bit longer on those areas. So you can see how quickly it goes on. Gina's already done about 8 cups here in under a minute, so it can really go on quickly.
And then with the right amount, let me know if that hurts, and communicate with the person that you're putting cups on. If you have the right amount of oil, and sometimes the skin will absorb some of the oil, but if there's the right amount, then you can actually slide the cups while they're on the user's back or the receiver's back. It can feel really good when you're sliding them. It's almost like a massage, and then contrary to that, it can actually hurt if it's dry. So you definitely want to make sure there's a good amount of oil underneath the cups, and then just slowly manipulate to turn them, and that actually can kind of feel good. Now you want to communicate all the time, because I know from experience on a few guinea pigs early on that the skin is a little more tender down here at the low part of the back or the under of the arm, to where if you're starting to twist on thinner skin or more sensitive areas, that's going to hurt. But you just communicate and kind of experiment and have fun with it.
For the sake of video time, we will pause here and place the full back with cups, and then record again.
Okay, we're back, and as you can see now, we've placed the cups on the top half of Evan's back. The reason for that is Evan has been battling a cold for the last day and a half, and he does have something going on in his lungs. So we kind of want to focus on pulling in this area as much as we can. And then while the video was paused, we've let this sit for a few moments. And then because it feels good and because it helps, we're going to go ahead and just grab some of the oil. And I did add a little more oil before we hit pause. And then you just kind of lightly take them and slide them kind of around a little bit on the skin. What feels really good, and I think my cups are they're a little tight.
So again, the recap for the home use set, it's usually 2, at most 3 pumps will give you the desired amount of suction. And then not everyone is comfortable with the twisting and the sliding. The glass cups for the professional use will sometimes slide a little bit easier, and you can do long gliding slides. The plastic set tend to do better with a little slight rotation. And then even at that, some people may have a sensitive back or sensitive skin, and you might just have to leave them in place, wait a minute to 5 minutes per spot, and then there's a little valve that Gina just showed, the little blue valve. You actually just pull up the valve. It releases or allows the air back into the cup, and then that releases the suction. We'll move the cups again in a minute and then show them aligned just up and down the spine, and a little bit of emphasis on the low back. So as you can see from Evan's back, Gina placed the cups up and down the spine, and then predominantly in the low back, because of Evan's low back tension and also some spine tension he has. As I mentioned earlier, most of the time when I do a cupping routine, I will do the entire back, but sometimes you can emphasize upper back for asthma, colds, bronchitis, phlegm conditions, mid to low back for specific areas of tension. And you can also see, as let's say we take some cups off here, there'll be areas where the circles are darker than in other areas. And the darker the circle, that actually indicates higher levels of tension, typically an area that would be more painful or bothersome for the recipient than one that's very faint. Either way, it definitely indicates what we call blood stagnation, so an area where the blood was not circulating as well. And we could actually continue this for another 5 or 10 minutes just to even cover some of the areas we've not covered yet. And it is important to let the recipient know that the circles can vary from very light to very dark. I often call that pepperoni pizza back. And that can last for 7 days, sometimes 10 days if it's a very dark circle. So if you have that dream vacation planned and you don't want to look like you've been attacked by an octopus, then maybe cupping's not the week or 2 week period to do that.
Right. Fantastic. Well, thank you, Evan, for volunteering to be our guinea pig today. And thank you, Byron, for showing us how to do all this.
Well, and thank you, Gina, for showing us how to do
Awesome.
it as well.
All right,
Thanks.
everybody, like and subscribe, and we'll see you on the next video.